from Marlon that Health Promotion Council, as an organization, is affiliated with a much larger public health institute in Philadelphia called Public Health Management Corporation. So our IF staff that's here actually supports all of PHMC and really has a broad view, not only of what HPC does, but of what all of the other programs and affiliates are doing, and handles all of that IF work across the entire corporation. So they bring a really important lens and perspective to this conversation. And so we're glad to have you all here. So thank you.
Yao Bukar, Database Administrator.
Michael McGow, Project Manager for the Application Development Team.
I'm Nicole Kang, Director of Family Services.
Donna Ferraro, Director of the Highway Safety Project.
Marta Wilson, I'm the Data and Evaluation Coordinator with HPC.
Sean McCormick, Manager of Traffic Control.
Gina Trignani-Kirk, Director of Training and Capacity Building.
Daryl Thompson, Director of Information Systems.
Hi, Lauren Mosquito, Director of Nutrition and Wellness.
All right, that's everybody on this side, Joni, so we'll go ahead and turn it over to you. You can introduce yourself and anyone you have with you, and then take it away.
All right, well, currently it is just me. However, if there are questions I can't answer, I will be recording those and sharing them back with you all. So hopefully I can answer quite a few of your questions. Thank you all for spending some time with me here today. And I'm going to try to give a overall, a high-level overview of what Workshop Wizard is. However, Marlon has shared some information about the evaluation and indicators that you are looking for. So in these different areas, I'm going to try to share information about how you can find and get some of the data that has been shared with me. And so if you need a higher level, please stop me, or if you need me to go into a lot more detail, definitely stop me and ask me questions as we go. And otherwise, I'm going to go ahead and get started. Workshop Wizard really is a program, a software as a service that has been established to track community evidence-based curriculums. Now, with that being said, you are able to track any kind of program that your organization might be working with. So knowing that there are quite a few different programs that HPC is working with, Move and Eat for Health, the Child and Adult Care Food Program, any of that information can be tracked and put into the system. So I'm going to go ahead and log in. Now, if you decide to move forward with Workshop Wizard, anyone who has access to Workshop Wizard will have a unique login and password. Now, we can limit the access that each person has depending on the role that they have in the organization. So once this pulls up, you're going to see all access to Workshop Wizard. Again, that can be limited. All right, so again, here's all of our access. I'm going to come back to my workshops in a bit. Find just quickly is going to be another way to look at all the connectivity of the different functions over here on the left. Now, if I go to People, and this is kind of my People tab, this is going to be where I'm tracking any organizational contacts. So this could be someone that you met at a conference. This could be someone who has been trained in a certificate program. This is going to be where all that information is tracked and kept. Now, people types, these are going to be the types of people who are identified over here. This again acts as a search function and also links to the different areas over on the left-hand panel. You would have access to add any type of people type that you would like, and we'd like to say that you want to keep. Oh, go ahead.
Hi, Joni.
Yes.
Yeah. For some reason, there's quite a significant delay in whatever actions that you're taking walking through the workshop wizard and what we're seeing here on our screen.
Oh, interesting. Let me log off of here and see if I can open it back up. I'm afraid that might be on the GoToMeeting side. So let me see. Are you currently seeing the workshop wizard?
Yeah, we're seeing the workshop wizard, and and you're on people types.
Oh, that's what you're seeing currently?
Yep.
Oh, wow. Okay.
Now
Let me try to modify my screen. All right. Okay. And did it show me log back in by any chance?
Yes. Yeah, we're at your home screen now.
Okay, where it just says Workshop Wizard with the green over on the left?
Yep, we see you scrolling.
Yeah, okay, good. Hopefully it's caught up.
Okay.
Okay, so I'm going to go back to people. Did that pull up okay?
Yes.
Okay, wonderful. So again, this is going to be where you're able to track different people's certificates. We're able to give them access. So depending on their role, the types of functions they can see over to the left. This is also where we are going to limit the access of the different partners and the different programs. So if we want just to have Pennsylvania Community Living Initiative be able to just see their information, this is where we would limit that access. I'm going to go back over here now to General. And again, here's all our information and contact information. All you have to do in Workshop Wizard is tell it exactly what you want it to do. So I'm going to add a person. I'd fill in as much information as possible. Now I'm going to make Tim an active leader. I'm also going to make Tim a site contact, an organizational contact, and let's also make Tim a referral handler and a workshop contact. And then I'm going to save those changes. Now if I want to go in and I want to put Tim into a class, so Tim has either taken a training, so as a student, or Tim has facilitated a training or a workshop as the facilitator or teacher, then this is where I would put that information in. So all I have to do is pick the class, pick the role that Tim has played. I'm going to say that he was a facilitator for the Chronic Disease Self-Management class. And now I have that, so I can go back and look to see the last time that Tim was a teacher, facilitator, lifestyle coach, whatever that might be. I'm also able to go in and track Tim's certificates. Now, any certificate can be added to Workshop Wizard by going to the Curriculums tab. And in just a minute, I will show you how that tab works. So for example, if we were trying to look at the ServSafe Food Manager certification, we could add that under the Curriculum tab, and then it becomes available to us here under Certifying Curriculum. Just going to make Tim a leader in Matter of Balance, which is a falls prevention class. I'm going to say that that certificate is going to expire in 1 year. And then I save my changes, and now I show that Tim has populated as a Matter of Balance certificate holder. Now where this becomes important, and some of the evaluation information that I know that several of the programs and partners are looking at, is being able to see who all has been trained in a specific certificate, looking to see who all has taught in a specific curriculum, being able to look and see who all is going to have a certificate that is expiring. So all I have to do if I want to search that information is I go to whatever certificate I would like to find. I'd search that information, And these are going to be the people, and again, this is all because it's a demo data, so no one in here is real. But this would pull up everyone with the certificate of matter of balance. If I'd like to run a report on that, all I'd have to do and now I have the people with the information about who all has that certificate. If I go back here, I can also export that information. This would pull up the information in a CSV, which then is going to be able to be edited like an Excel spreadsheet. So we also wanted to find anyone who is needing a fidelity. We can search anyone who is going to have a certificate that is going to expire within 13 months. Now you can filter these searches by anything that is listed on the search page. And so again, this is going to allow us to track things like number of partners receiving training, any type of fidelities that are needed, trainings that people have attended, classes they have taught, and the roles that they have had, and the types of information as far as their contact information and the role that they may be playing in an organization. So for example, again, if I wanted to go back through and just find all of the people who I consider an active leader, oh, there we go. Then all I have to do is search by active leader. Okay, so people types, again, this is where I'm able to add those different search functions. In MET-Through, this is going to be where I might want to add someone that I've met at a conference. This could be someone that, again, is going to be training with us. Just another way of having a search function and keeping track of your contact information. Again, under the People tab, this is not going to be anyone we're enrolling into a program. So this would not be a community member. This would be someone who is either trained, a partner of an organization, or just a contact within an organization that we are linked to. So prior to me moving on, I want to see if there's any questions here or additional information I can provide under our Contact/People tab.
Hi, this is Carrie. I have a question on the People tab. So you're talking, like, if we get a business card from somebody at a meeting or a conference, is there a way, and we want to enter in this information, but we want to be able to, contact them on a sort of regular basis via email. Is there a way to link this with our Outlook account, so it's not like we get a business card and you have to enter it in this and also enter it in our Outlook?
Currently, there is that function. However, with additional programming, and it does come with programming costs, that we should be able to do that, but I'd want to confirm that with my IT.
And likewise, with this People tab, like if we wanted to send a letter to, let's just say Christmas cards, we want to send Christmas card to every single person in the HPC network, partners, colleagues, all that stuff. I mean, is there a way that you could download this and you would be able to print labels or personalized letters from it?
Yes, there is. So basically, we are able to track a good way of doing that. Is all I'd have to do is say I want to add. I save my changes. And then whenever I am adding a person, then all I have to do now is identify them as someone I'd like to send a Christmas card to. If I search this, I'm obviously going to be the only one since I just put Christmas card in as a people type. But then you would be able to export to a CSV that would allow you to do mail merge. Does that answer your question?
Yes, thank you.
Wonderful.
Sorry, I have one more question.
Oh, no, this is great.
I'm new here, but I assume that everyone has probably a lot of contacts either in their Outlook or they keep a spreadsheet. Is there a way that you can do a one big data dump of current spreadsheets into this, or would we have to have somebody manually enter everything into this?
So what we would want to do with that is if the information was all in one Excel or one CSV file, we can do that. It would come with additional programming costs. So what we would want to do is look at the cost benefit. So trying to find out if it would be easier and more cost effective to put that information in manually. However, we do have the capability of putting it in one data dump.
Okay, I think that's our questions for now, Joni.
Wonderful, wonderful. All right. So, and again, we can always come back, and we'll be coming back to a few things on this people type, basically because these things, again, are going to link to some of this different functionality. So I'm going to move on here, and this area is just a lot of different types of organization. License holder, this is going to allow us to add any type of license that we want to bring in. So if you have a license for CDS&P, if someone is holding a specific license for another program, then this is where we would put that information in. So, for example, even though I know that we don't have licenses for the National Diabetes Prevention Program, I am still going to put that in here. What's nice is that I can put my CDC pending recognition organizational code in here also. However, this does not have to be used, but this would be for any type of license that we actually have. I'd save those changes, and it is now populated into the system. Now, health system, these are going to be any of those major health systems that we could possibly be working with. And so this would be any of those contact organizations, again, the health system as a whole. So, for example, if we were working with a Kaiser Permanente or a Circle of Care health system, Circle of Care might have 3 organizations underneath their health system. And so this is where you would put that overall health system. Now, organizations, these could be any partner or organizations that belong to a larger health system. So any partner that we are currently working with, so I'm going to go ahead, I'm just going to add. So this is going to be one partner that I know you all are working with a child and adult care food program. I don't know your contact here, so I'm just going to put in the new contact that I developed, Tim Smith. And if you remember under people type, I identified him as an organizational contact. If the Stenton family, we had a license with that person or with that organization, we would put that in here. Any connection with a health system. And then we would add any type of organization that this might be. So this could be a partner we're working with, this could be a donor, this could be a, again, smaller organization under a larger health system. Of course, as much information as possible. The system's only as good as the amount of information that's put into it. And we're going to say that this organization is offering a few different curriculums. And I'm going to go ahead and save my changes. And now we have that partner in our organizational contact. Now sites, these are going to be the different locations that we're either working with our partners or where we're holding our different programs. And so we can enter in any site that we want. site identifier is up to you if you would like to use it. I'm going to use it just for the sake of the demo. I put in, again, as much information as I can, but I'm going to go ahead and link Demo Site 1 to our organization here. If I can find it, here it is, that I just put in. I save my changes. I know it's populated. And now if I go back to that organization, I now see that Demo Site 1 is a site that is connected with that organization. Organizations do not have to have a site connected with them. Again, they can just be partners. However, if it's an organization that is delivering programs at different sites, this is where that information would get tracked. Sites do not necessarily have to be linked with an organization. So if you have different sites that are possibly under, that are standalone and you don't want to necessarily track the organization, however, you would probably more than likely want to do that, then you're able to enter in that information. So I'm going to go ahead now and see if there are questions about this kind of organizational section of the Workshop Wizard.
Joni, this is Gina. I just wanted to clarify, so if it's, you had Stenton Family Manor, if they were running multiple programs, we would see a list of their multiple programs in that box that you had pulled up with Demo Site 1?
That's correct.
That's correct. Okay.
So and the way that will happen is actually in the workshop where we would see the different programs they're running. And so underneath the organization here, that's going to be where we're seeing the different types, different sites that Stenton Family may be running programs.
And then one more question. So if we had all of our different departments or programs, we could also attach whether or not they're working with multiple programs, and that would be listed also, or we could query
and
that.
Can you repeat that one more time for me? Sorry.
If we have one organization that crosses over multiple programs within our organization, can we put in? We will have a list of all of our programs, of course. So can we query? Would that show up as a potential list of the programs that they are intersecting?
Yes, absolutely, absolutely. So that's actually going to be in our next section here. And so if there aren't any other questions, then I'll move into that and we can go directly to that question.
Okay.
All right, wonderful. So under curriculums, this is going to be where we add any program that we're currently doing. So I'm going to go ahead and I'm going to add I'm going to say that this is currently a workshop, meaning that it's open to the public. If this was a training where someone was going to be certified, again, and I'll build another certification here in 1 second. I'd save those changes, now populated. And now I'm also going to say, let's add a certificate in here. I'm going to make this one a training, and I'd say save. Since that is a certificate, I could go in and actually add rules to that certificate. And then I could add the criteria where if it's a certificate, you have to teach or have a refresher at least one time within 12 months. And then again, it's going to give you all the information that you might need to track that certificate. Let's save that change. Now I'm going to move into workshops and trainings here. And the question that Gina had just asked is if you can query by organization, and you are able to do that. So again, I don't have any programs currently added into Sinton Family, but I will add one here in a second. However, I can query by each organization that I have entered in. So if we went to General, add a workshop here. And we just added the child and adult care. There we go. We could pick our site of where that is being held. I'm going to go with my new demo site. And then this is as much information, again, that we can provide. I'm going to make up some dates here. Now, if you remember at the beginning, I made Tim Smith a workshop contact. I'm going to go ahead and just identify that. Again, we could pick any of our health systems that we're working with. The single-use and multi-use survey, I'm going to come back to this because this is a new feature, and I think this is going to hit a lot of your evaluation information. Actually, I am going to go ahead and do this now. Our single-use survey, this is going to be if you're collecting any type of demographic information, any type of information you're only going to collect once. So your multi-use survey, that's going to be your pre- and post-test information. And so I'm just going to go in and go ahead and say, let's use a single, and let's go ahead and use a multi-use. We can track our funding sources, and go ahead and say save. Oops. I can put membership in here, so I can also put in anyone that is going to be facilitating the program or working with the program. I'm able here to track any of my paperwork and also fidelity visits, and I can print class information. I'm going to go back to search here, just search kind of all of the classes that we have entered into the data site. And again, just kind of show how each organization, if we wanted to just search, and we can query the different classes that they are, or programs that they are hosting using the curriculum information here. I went here, and now I also am able to pull up through this one organization. I see that they are, they have the programs leader training for chronic disease self-management, and they are facilitating chronic disease self-management in the community. All right, so let me go ahead and open that. Hopefully, Gina, that answered your question. And again, these are all filters here that you're able to search by or have queries by. And in addition to that, you can also search using site information. Okay, I'm going to go ahead and open that up. Are there any questions about this section or how it can be used?
So I just want to clarify, and I think you did answer Gina's question. So if, I'm going to kind of take it one step further. So there's obviously the CACSP program sits under our nutrition and wellness department. So let's say that they're for some reason in a fictitious scenario, they're running a similar program or curriculum that we're also running in tobacco control or in training in capacity building. We definitely would be able to.
Here. Oh, go ahead. I'm sorry.
No, I just want to make sure that we definitely would be able to kind of query across those departments, across those different programs, and pull up that like information.
That is absolutely, yes. Yes, we can. So how I would do that is I would go in under new organization. I would put in, go ahead and save that. And then whenever I am putting in a workshop, I'm able to connect that under the different sites that are actually connected with the tobacco program, or tobacco department, sorry. You can also do that nutrition as a whole, and then we can put sites underneath there. But yes, there are ways of doing that. Without a doubt, we would just have to maybe talk a little bit because, you know, we'd be using some different vocabulary. And so we would want to make sure the vocabulary matches. But right, yes, the quick answer to that is yes.
Okay, great. And I think that may be part of why I'm asking the question, because of the vocabulary, where some of our departments and or programs might use, you know, particularly around our CDSM or CDSMP project, would use language like training or workshop, where maybe another department or program might not necessarily call it that. So, you know, and I'm sure, again, to your point, there are ways to kind of to work through the vocabulary and how things are listed, or what the universal understanding across the platform is for, you know, what exactly we consider a workshop versus a training. So, but I just wanted to make sure that I was able to ask that question.
Exactly. And, you know, another place where the vocabulary could be more generalized is under organizations, because we can separate departments by putting them in under organization.
Gotcha.
So if there's several departments, even if it's under one organization, we can break that out.
Okay.
And, you know, if that's something, if we do decide to continue to move on, then we can discuss some of that vocabulary so that we can make a nice kind of general glossary that will cover what each of those things mean.
Okay,
and how they
great.
can be. Okay.
Great.
So under this area, you know, we can collect information on number of new programs being created by searching within a date range. We can look at types of trainings that are being facilitated, because they would be listed under our curriculum. And so there's quite a few different evaluation measures that can be brought here. And again, this is going to be where we set up any type of surveys that we are going to be looking at, which I think is going to really hit on some of the evaluation measures as we move forward. So prior to me moving on to our next area, which is kind of the referral/enrollment area, are there any other additional questions under curriculums and workshops?
Nope.
Wonderful, wonderful. Okay, so under this next area, this is where we would be tracking our providers, the practices that we're working with, and tracking our enrollment into programs. So our referring entity, this is going to be our overall entity, so one practice, one hospital system. This might be a rec center. This is a place where we are going to track and keep information where there might be several individuals referring into a program. Now, under referring individuals, that is where we want to link the person, the individual, into the referring entity. So, for example, Joni with her maiden name, who's a doctor in another life, is linked to the Bridgegate medical entity. Now, where this comes in handy is when we are referring or enrolling people into the program, that we are able to now search specifically either by entity. Let's search it alone. So these would be everyone who's been referred by Bridgegate, or we can actually search it by provider or referring individual. I'm also able to print that information. So now I have information that everyone that has been referred from Bridgegate by Joni Patterson, and have that listed quickly. Now this is also, again, going to be where I add anyone who is either just calling about information, or I'm reaching out to, or I can enroll them into a program. Again, I can designate a referring entity, a referring individual, enter in as much information as possible. I can track the referral date, which class they're being referred for. Again, here's our food program. And then when I'm ready to enroll somebody into the program, I just select the program that has been entered in under our workshops and trainings. I'd save those changes. And now I have Sam Davis enrolled into the Child and Adult Care Food Program. I can track my past contacts. So I maybe have had to call Sam 3 times, and I might have 2 different people handling the information. I'd go in here and track that information here. Again, at the beginning, when I put Tim Smith in, I identified Tim as a handler, referral handler, and I save any changes with that information. Now again, if I go back to search, I have the ability to search by any of the filters that are listed here. I do know, though, one of the evaluation measures that, or at least one of the desired indicators, is being able to find information about referrals from entity or specific individuals. And that's going to be where we are able to actually track that information. So I'm going to hold here because I know this is a pretty important area, and just see what kind of questions you might have. Okay, I'm kind of liking silence.
No, yeah, I think that a lot, this is Christina, sorry, I think I'd like to get to the participant section and the report section. I think that some of the questions that I have are going to be answered there.
Absolutely. All right, well, let's move there. So, participant section, this is going to be where you enter in any of the demographic information that you would like to collect for your participants. Search function, just so you can see that we have some information entered in. You saw the programs, so this is not a lot of information compared to the number of programs. However, if I go to General, I'm able to add participant information into this area, which is going to be our data collection area. So here's the general information that Workshop Wizard becomes populated with. Now, if I needed to collect additional information, and if you remember under Workshops, I said that I wanted to make a survey that might have a single use or a multi-use, then all I have to do is go on survey, and I'm able to put in any type of indicators that I would like to have here that we might be tracking. and I would save my changes. Let's go here. I'm going to make that pre-post, and we'll have a follow-up. Save that change. All right. So now, whenever I do go in to this information, oh, I have to put participants in. Sorry about that. That I am able to actually come in and add information to the participant area based on that survey information. I'm able to add questions that I might be needing to use just by going in here and adding questions. I have choice lists, and I also am able to export formats into either a CSV Excel type sheet, or we can pull it up in a PDF or Word document. Now under reports, this is going to be where I am able to run generalized information, and this is going to allow me to run either 1-column or 2-column report. With this, I can either then run a report that is specific to one area, or if I need to be able to have comparisons. Let's go ahead, and I am going to run this report. Let's make it only for one organization here. I can also filter my reports by sites, counties, my leaders. I can filter these reports by date range. And it's going to pull up a Word document that I can edit with the information that is currently populated into the system. Again, the more information we have populated into the system, the more valuable these reports become. Create another report. I'm going to do this one as a comparison. I'm going to take out the strong health just because that's what I would like to compare. So now I know that strong health compared to all the other organizations, all organizations have had 14 programs. Again, I can filter that by specific program. I can look at the participants and their average, and I'm able to look at the different averages of the organizations that we're working with, their healthcare systems that we're working with, and we can look at completer rates. And again, this is going to be as valuable as the information that gets entered in underneath that participant tab, which is up here. All right, so I want to go ahead and open up for some questions, because I figured this is going to be where we have the majority of those questions.
So this is Christina. I'll start. So with regard to some of the participant data, so I just want to make sure I'm understanding some of it correctly. And so we have participants. We have individuals that come to us from other parts of PHMC, from other programs within PHMC. So if I have a new client or someone that feels like a new client to me in my program, as I start to enter that person's information, am I going? Will a list of people with similar names pop up so that I might be able to see if we're already serving that individual in another place?
Well, under the participant tab, this is going to be information that all gets de-identified once it's entered into the system. If you would like to track that, then all you would have to do is put the person's name in here, search them, and it would pull up their information if they had been in another program or referred there by another organization.
So I would have to go to the referrals section to do that. Like
That's correct.
If we had someone that was just entering data on participants in Class A at Site B, they would have to first go through the referral section to see if they were already with us.
Well, if that was the case, then, and so you're saying rather than, this is going to track, this is going to be entered in for the participants that are in each program. So if they're in Program A and also Program B, then their data would be entered in for both of those programs.
And then that individual would have two separate records within the system?
That's correct, depending, specific to the program that they're in.
And would we be able to link? So, I mean, we would want that person to have one single client record across the entire organization so that we can better identify who is being served across multiple programs within the organization and better track their outcomes. And I think from an evaluation standpoint, longer term, you know, be able to identify changes in health status, in health behaviors, you know, program outcomes for
one person throughout long term.
Right, and I think, you know, beyond that, you know, can we then say that, you know, people that have touched 3 different aspects of our organization, are they substantially better off than individuals that have been served through one program?
Okay. So what I'm going to do with this question is I'm going to ask our programmer the capabilities of that, and then I'm going to get back with you if that works.
Yeah, that would be great. I think the value of a single client record is pretty high.
Yeah, I'm definitely following from an evaluation standpoint. At least I think I'm definitely following from an evaluation standpoint. What I will do is type up the question in an email form and make sure I'm asking the correct thing, and then we can kind of move on from there. But I feel like I have an idea of what you're asking, and I definitely see the value. So let me see if we can figure that out.
Thank you.
About the program, are you talking policies included or all of it?
Oh, because I know that's a priority across the agency as well.
So, the first thing would be, we need to understand what the integration capabilities are, and how we get data into and out of it efficiently. Does this have an API? I guess you might have to know what it is. But,
Hi, Joni.
And I'm kind of having trouble hearing you. I'm not sure if that was a question for me or not.
Yep.
yeah, I shifted from one thing to another. Does this system have an API or application programming interface? Will we be able to integrate our system with it to share people?
Yes, and I'd want to put our programmer with our IT. This system can run it's more running, you know, obviously in the backdrop, and so that would be something I'd want our programmer to talk with your IT about. But my understanding is that is something that we should be able to do.
So is it something that is already included, or are you saying it's something that you have to program?
That's what I want to check on.
Okay.
And may I ask who just asked that question?
This is Daryl Thompson.
So our IS director.
Wonderful. Yeah, Daryl, we'll probably want to get you with Harry McIntosh to talk about logistics on something like that. Other questions?
Joni, this is Sean McCormick from Tobacco. I have 2 questions. One is for the participants and the fields of entry, is that customizable? Like, could we add e-cigarette use, yes or no? Like, say we decided we want that in there later.
Absolutely. What you would do there is whenever you want to develop a survey, you would just put in any additional questions, any type of modifications you would like under the survey section.
That's cool, but what I was asking about was related to the participant file or the client file.
So under this right here?
Like, what chronic diseases do they have and all that sort of stuff on that page, wherever that was.
Okay, so this information right here?
Delayed just a second, so give us 1 second to see what you clicked on. Yeah, in there. Is that customizable?
You can add, and so would you're saying like you would want additional conditions or just customize different questions?
Yeah, I mean, all above, all of the above.
Okay, so this is going to come populated as it is, as you see here. If you don't want something that is already programmed in there, then that would be something that, again, we'll talk with IT and would come with programming costs. However, if you would like to just add different questions to it, then that would be something you would just add under surveys.
Okay, thanks. The other question I have is a little bit different. I was curious as to whether or not this is compatible with mobile platforms like Android, Apple. Can someone jump on their iPhone and get to this?
Absolutely. Because it's a software as a service, it is, as long as you can get to the internet, you can get onto it.
Okay, thanks.
So just to drill down on that question, are you saying that they can access it via the web browser on the phone or
that is correct.
So you don't have an Apple or Android app for it?
Oh, I'm following what you're saying. No, currently we do not.
Okay.
It would be through web browser. Thanks for clarifying. Other questions?
Joni, this is Christina again. I may have missed you mentioning this. So, so for all of the participants that complete, survey Z, does this also compile the results of that and allow us to analyze the results of those surveys for that evaluation?
I think I'm following what you're asking. Let me see if I can show you here. Let's see. Oh. Yes, all we would have to do is identify which type of survey data that you're collecting, and then you would just search it and it would pull it up. Currently this isn't populated. However, yes, the answer to that question is yes.
So you have to be able to analyze that data, not just see the number, not just see who completed it, but actually be able to analyze that data.
Yes. Are you talking about like being able to pull it into a CSV and then be able to run reports on it?
Yeah.
Yes. Yes. So let me see. Well, I'm having trouble with this. I thought I did it earlier. And so this is what would come up. Again, this can, depending on, what type of other surveys you're using or other questions you want to add. And this would have all the data listed in that you've collected. So I'm not sure if that answers your question or not. However, this is going to be your the form that you can manipulate.
Okay.
Is that kind of what you were looking for?
I think so. Like if we have like 100 people that have done a pre-post, have done like a pre-test and a post-test for evaluation purposes, what I wanted to know that we could pull out their responses for those pre and post tests so that we can then look at that data.
Yes. Yeah, definitely. So whenever you would pull from the search, you would again just filter and then show the pre or post that you're looking for, which would probably be under multi-use. So assume that says pre-sample 1. You would just search by that and pull it up the same way that we just got this information. And it would come in this, this format. So yes, it would just be a matter of filtering. Other questions?
What type of security protocols do you guys have associated with the application?
Yeah, absolutely. So basically, we have a secure connection. So we're using an HTTPS, so similar to what you'd see on credit card or banking government websites. The server is protected with standard security procedures, so that's going to include firewalls, security updates from Microsoft, antivirus software, and additional measures that we encrypt the information when it's stored onto the server's disk. And so if someone was able to gain access, all the information is not readable. It's backed up, and so the server is backed up every evening to a server across the country. So in an event that there is some type of catastrophic happening, a fire, some type of flood, the data is backed up and encrypted again so that we're able to come back and save all your data. And depending on the access that you want someone to have, again, that is going to be limited by your administrators. So when you add someone in to the Workshop Wizard, you can limit exactly what they see and the information that they can enter in.
Okay. How often is the data backed up?
It's backed up every evening.
Are the backups encrypted?
Yeah, that's correct.
From an encryption standpoint, do you employ encryption at rest at the database level?
And can you repeat that one more time for me?
Do you employ encryption at rest at the database level?
And I'm sorry, I'm missing the word right before database level.
Oh, rest. R-E-S-T.
Rest. And I'm not sure if I'm following the question completely. However, I'd be happy to get back with you on that if that works.
Yeah, that's fine. I'm trying to understand at what levels you're encrypting. You can encrypt the data at the database level when it's at rest. When data is being updated, in some cases, the transport protocol is not encrypted.
I'm following. So yes, it is. It's being encrypted every time that it is backed up and during rest.
Okay. So there's no transport encryption?
Let me find out that for sure. So I don't want to tell you the wrong thing on that. Wonderful. I will get back to you on that question. And was that Daryl, I assume?
Yes.
Okay.
If you could just, I guess, get my contact information from Marla.
Okay, that definitely works.
And I'm thinking at some point it might be helpful for your IS or your developer to talk directly to Daryl or somebody that he designates from his staff to be able to talk in detail about the the back end technology.
Absolutely. I would love to set that up. I speak a limited amount of technology. I know it's a special language to know. Okay, any other questions, thoughts, or comments?
No, we don't have any. I think if there's an opportunity, just as particularly we know that the two IS departments will touch base at some point, but there's an opportunity for follow-up from our directors who are probably processing a lot of what they've seen and have an opportunity to just kind of go back and think about how all this translates on a day-to-day basis with their departments and the different types of information that they're collecting. It will probably be helpful for them to be able to either touch base with you, or we could have a single point of contact to be able to compile additional questions and comments and get that information to you to respond to.
That would be great. And I will kind of leave that up to you all. If it's just the directors, that should work fine. Whereas once we start getting into staff, that'll be a little bit of overload. However, if it's easier for you all to go through a single point and then we can compile all the questions at once, that works also.
Okay, we'll probably go with the latter.
Okay, wonderful.
All right, so I think that's probably it. We'll definitely be following up. I think next steps are I'll connect you with Daryl so that we can arrange some sort of conversation with your IT person in our IS department, and he'll be able to provide us some feedback. And in the meantime, if our directors have any questions or anything to follow up with, I'll probably serve as that single point of contact and ensure that you get those so that you have an opportunity to respond to any questions or comments or concerns that we may have going forward. And then we'll kind of take it from there.
And I'm going to convert this webinar, and so you'll have a video format of it that you can share. In addition to that, I'm going to check on whether or not the People tab can link to the Outlook, link to your Outlook, whether or not we can follow one person over multiple programs long term, and also the transport encryption as the 3 questions I pulled from today.
Sounds good.
Thank you.
Wonderful, wonderful. Well, thank you all for your time. Happy Friday.
Thank you, Joni.
Thank you.
Appreciate it. We'll
Absolutely,
be in touch.
and I'll be looking forward to your other questions.
Sounds good.
Take care. Bye.
All right, you too.